Good afternoon. My name is Myron Franz. I'm the Commissioner of Minnesota Management and Budget, and as a Commissioner, I'm the state's Chief Financial Officer. And today, I'm here with the state economist, Dr. Laura Klumbakidis, and the state budget director, Britta Rayton, to present an updated budget for your review and consideration. Before I begin, if you're listening online, you can go to mn.gov/MMB, and you can find this presentation that's loaded there. A little more than 2 months ago, we forecast our economy looked like it was in good shape. The U.S. economic outlook remained stable, and Minnesota had a projected surplus of more than $1.5 billion for this biennium with low unemployment. In her remarks last February, Dr. Klumbakidis said that one of the forecast risks was the prolonged and widespread virus outbreak, referring to the coronavirus. Well, since February, economic conditions have dramatically weakened. Our economic outlook remains volatile due to the coronavirus. Last month, Governor Walz requested an updated budget projection that takes into account the extraordinary situation so that he and the legislature can have the most up-to-date information as they finish the legislative session on May 18th and make decisions about the state budget. Today's updated budget projection is based on the new U.S. economic data from our consultants, IHS Markit, and the current biennium for fiscal years 2020 and 2021. We have updated the largest general fund revenue sources that Dr. Klumbakidis will talk about, and we've also updated some of the spending items that Britta Rayton, the budget director, will talk about. We have also included money that has been appropriated during this legislative session specifically to respond to the COVID-19 pandemic. Based on current economic conditions, we now project a $2.426 billion deficit for the current biennium, fiscal years 2020 and 2021. This is almost a $4 billion change since the February forecast. I want to be clear, the deficit of $2.4 billion is before any use of the state's budget reserve. But before I turn it over to Dr. Klumbakidis, I just want to mention, as people around the state know, that over the last 9 years, we have worked consistently to build our budget reserve to its current level. Later in this presentation, I'll talk more about the budget tools available to the governor and the legislature, but now I'll turn it over to Dr. Klumbakidis.
Thank you, Commissioner. I'll start by presenting the U.S. outlook, move to Minnesota's economy, and then present our new revenue projection. The outbreak of COVID-19 and the measures taken to prevent its spread have dramatically weakened the outlook for U.S. growth since we released our forecast in February. IHS is now forecasting a three-quarter recession, resulting in a 5.4% decline in real GDP in 2020. In contrast, in February, they had forecast 2.1% growth for this year. Consumer spending, which accounts for two-thirds of U.S. GDP, has been hit hard by the pandemic crisis. Temporary business closures, social distancing measures, volatile financial markets, rising unemployment, and declining wage income contribute to a forecast 5.5% decline in real consumer spending this year. So the first chart shows the level of real GDP. The solid line shows the history and IHS's April outlook, which informs today's projection. The dotted line shows their February outlook. In the dramatic dip in the solid line, you can see 3/4 of declining GDP this year. IHS notes that their outlook depends critically on the path of the pandemic. They expect the spread of COVID-19 to peak and then dissipate in early summer, allowing social distancing restrictions to be lifted during late summer or early fall. Economic recovery begins then, and real GDP growth turns positive toward the end of the year. Real GDP is forecast to grow 6.3% in 2021. You can see from the graph that IHS expects GDP to reach its pre-pandemic level in mid-21, but within our projection horizon, GDP does not get back to where it would have been without the pandemic. We never get back to that dotted line. Some amount of economic activity is simply lost. I could show you graphs like this for other variables, for instance, for consumer spending, which informs our sales tax forecast, or for total wage income, which informs our income tax projection. And the pictures would all be the same. A deep plunge this year, followed by growth next year, but never reaching the path that we had been on. The shock to the U.S. economy from the pandemic is unprecedented in modern post-war history, and the economic outlook is exceptionally uncertain and volatile. Economic outcomes will depend critically on the pandemic's course, the prospects for an effective treatment and vaccine, government restrictions on activity, consumers and businesses' responses as those restrictions are lifted, and the impact of fiscal and monetary policies. The U.S. economic outlook will remain volatile and uncertain for some time. Let me turn to Minnesota's outlook. Minnesota entered the COVID-19 crisis with a high demand for labor, low unemployment, and job growth that had slowed to below the U.S. rate amid a limited supply of workers. The disease outbreak, the restrictions applied to slow its spread, and the U.S. and global economic contractions have rocked Minnesota's economy, and generated conditions that will remain volatile as long as the pandemic persists and as long as the U.S. outlook remains uncertain. Now, official economic data lag our observations about economic activity that we see as we go around our daily lives, making it difficult to precisely measure how the COVID-19 crisis has already impacted the state. However, one frequently published statistic that reflects the labor market is the number of people who have filed initial claims for unemployment benefits. According to DEED, since mid-March, an unprecedented 600,000 Minnesotans have applied for benefits, indicating a dramatic increase in layoffs by the state's employers. So in this chart, we show the annual growth rate in total Minnesota wage and salary income. So that variable is the sum of all the payrolls of all the employers of the entire state, and the height of the bars shows the annual growth rate in that variable. The dark bars show the history, and then the striped bars show our new projection. As employers reduce hours, cut pay, and lay off and furlough workers, we estimate that total Minnesota wage and salary income will decline 5.9% this year. We now expect wage income to grow 0.3% in 21, but not reach its pre-pandemic level until 22. Turning to the new revenue projection, total general fund revenues for the current biennium are now projected to be $3.611 billion less than the February 2020 forecast. The estimates for all major tax types have been reduced. Individual income tax receipts are now projected to be $1.659 billion less than the February forecast. The decrease is primarily due to that projected decline in wage income I just showed, as well as declines in non-wage income, including business income and capital gains. Sales tax revenue is now projected to be $1.351 billion less than the prior forecast, and that lower projection is consistent with the lower forecast in consumer spending that I talked about earlier. The corporate tax is projected to generate $405 million less than the prior forecast, based on a lower forecast for corporate profits. Finally, let me reiterate some of the many risks in this forecast. Related to the path of the pandemic is the path of consumer and business confidence. Some businesses that have temporarily closed or seen declines in revenues are facing significant uncertainty about reopening or even survival. And it is not clear when consumers will have the means and the trust in public safety to get back to spending. Increased financial market volatility can hinder consumer spending by lowering household wealth. The impact of federal fiscal and monetary policy, while it is incorporated into the U.S. outlook that we used, the impact is still uncertain, as is the extent of additional federal financial support to state and local governments. Delays in Minnesota tax payments that have been allowed during the crisis also delay the signals about the economy that we normally use to inform our projections. The revenue picture will be clear to us later in the summer. And finally, with 14 months remaining until the end of the biennium, even small changes in the growth rates of some important revenue sources can have big changes in the outlook for this biennium and the next. I'll now turn it over to State Budget Director Britta Rayton.
Good afternoon. I'm going to walk quickly through the expenditure side of this budget projection. Overall, projected spending is up $391 million relative to our previous projection in February. This change has two parts: the spending enacted by the legislature since the February forecast, and the projected changes in spending due to reestimates as part of this interim budget projection. First, the legislature enacted and the governor signed into law $550 million in increased general fund spending so far this session. This spending is almost entirely dedicated to the COVID-19 response. Over the coming weeks, some of this spending may be redirected to federal resources provided to Minnesota either through the CARES Act or reimbursed through FEMA. So the general fund impact of that spending may be reduced, but this estimate reflects current law, which directs the spending from the general fund. The second component of the overall change is an updated budget projection for Health and Human Services spending. This update is shown in the projection change column and shows a decline in anticipated state spending since February of $160 million. The only bill area we re-estimated spending projections for since February is the Health and Human Services area. This is because Health and Human Services spending tends to be more variable based on economic conditions, and the spending is counter-cyclical to the economy, as participation in public programs tends to increase during economic downturns. The underlying economic data does drive increased participation projections in this estimate, particularly in fiscal year 21. This participation change drives increased cost estimates of $164 million. However, these costs are more than offset by additional federal funding for the medical assistance program since the February forecast. Congress passed an increase to the federal match for states in the Families First Coronavirus Response Act. The expected growth in federal funding is $330 million. This increased federal funding reduces state expenditures in that program and more than offsets the increased costs due to the growth in participation in public programs. Combined, this results in a reduction in the spending projection of $160 million relative to February. And when that projection change is added to the legislatively enacted changes since February, we see the increase of $391 million. As I mentioned before, we did not provide updated estimates for the other bill areas with this projection. The only changes you see here in other bill areas are due to the changes enacted by the legislature to date during this session. So turning to the next slide, this slide brings together the revenue and expenditure sides of the budget projection. As Dr. Kolumbakidis explained, the revenue projection is down $3.611 billion compared to previous estimates. And as I just walked through, the spending estimate is up $391 million compared to February. There is also a change in our reserves, but it's in the stadium reserve. And this estimate has decreased by $63 million, leaving $66 million in that reserve in this projection. This is due to a dramatically reduced amount of charitable gambling revenues compared to our February projections. The changes overall result in a projected deficit in fiscal years 20 and 21 of $2.426 billion. And now I will pass it back to Commissioner Franz.
Thank you, Budget Director Rayton and State Economist Laura Kolumbakidis. So, sound fiscal management is what we've been talking about for years. And when you do sound fiscal management, you consistently plan for 4 years, not just 2 years. You ensure that the state revenues grow faster than state spending. And whenever the state has a surplus in November, you take 1/3 of that surplus and put it into the state budget reserve. Our budget reserve is now $2.359 billion. Thank you to Governor Dayton, Governor Walz, and the Minnesota legislature who all worked together to build our state budget reserve. There is a reason we call the budget reserve and the cash account, which is another $350 million. There's a reason we call that a rainy day fund. It's for a rainy day. And well, today is a rainy day, unfortunately. Now is the time to use some of our $2.3 billion rainy day fund to help Minnesota weather this severe economic downturn and give policymakers, the governor and the legislature, time to consider options to maintain critical services and support growing needs in the face of declining revenues. With this projected budget deficit, the governor has the legal authority to use the reserve to restore budget balance. We need to be cautious, targeted, and focus on the choices that we make to balance our biennial budget. In the coming weeks and months, the governor and lawmakers must also examine our revenue and cost structures to rebalance the budget. Some people have asked about the use of unallotment. This is the budget tool where appropriations under current law can be canceled or reduced. Unallotment can be used by the governor only after the budget reserve has been fully depleted. I also want to caution against relying solely on the reserve to close this budget gap. Depleting these funds in this current situation is difficult because we know revenues are going to continue to decline during the remaining 14 months. And there are many factors with a high degree of uncertainty about today's budget projection. While we design budget changes for this biennium, we do need to recognize a budget reality, and that is we have decided to wait for information about the next 2 years, 22 and 23, to wait for more additional information. But we've learned during the Great Recession that this recession now will have effects on the next biennium. I want to show just a little bit about the complexity of this situation we're dealing with. We have federal streams of dollars for response, state streams of dollars, and also local businesses and philanthropy. Minnesota has already received federal funding of about $2.18 billion from the Coronavirus Relief Fund. We have also received some grants from the government for direct programs like K through 12 programs, higher education, transit, and others. Individuals and businesses are receiving grants and direct payments through both the federal government and state government. Minnesota, along with all the states across the nation, will need additional funds from the federal government to help balance our budgets as revenues continue to decrease and spending increases to save lives and to slow the virus's spread. At our state level, Governor Walz and the legislature have already provided $550 million in investments to respond to this crisis, including for public health, healthcare providers, child care, housing supports, and small businesses. To reduce state spending, some of the federal funds that I mentioned will be used to reimburse some state spending. Private donors have also stepped up, and the Minnesota Disaster Recovery Fund, we have seen contributions of over $11 million to help address the most urgent needs. We're in a difficult time, but we will get through this together with government, business, nonprofits, individuals, and philanthropy working together, each contributing in their own way. The good news is Minnesota has managed our state budget well. We have made smart decisions and preparations for an economic downturn. We never anticipated it would be a downturn based on a global pandemic, but our rainy day fund now is at the highest level in our state's history. I understand that these decisions will not be easy, and many difficult decisions lie ahead. But we've entered this crisis with some budget tools to manage, and Minnesota can count on us to use thoughtful and smart decisions about how to rebalance this budget. During the last weeks of this legislative session, I will remind policymakers in the legislature that we do not need to solve all of our budget problems by May 18th. Both the economic and pandemic situations are constantly changing, and it is likely we will need to adjust this budget several times throughout the course of the remaining biennium. We should not overreact or underreact. We need to continue being focused, targeted, and strategic in our response. I'll turn it back over to you, Governor. Thank you.
Well, good afternoon, Minnesotans. Commissioner Franz, thank you. Dr. Klumkitis, thank you for the analysis, and Budget Director Rayton. Minnesotans, one of the things last month at the State of the State address, when I talked to you, I said it was going to be a long, dark winter, and I said there are going to be some tough days ahead of us. But we need to know what we're facing. And I think as we each and every day take assessment of where we're at, the health department is letting us know where things are going. We're hearing from Joe Kelly to talk about how we're building up PPE. It's also important to take stock of where the economy is. It's one of the reasons that we asked for this special analysis and budget forecast. People who are here and are around the Capitol a lot know that the rhythm is we get one in November and we get one in February, then the legislature goes to work. As you saw, that no longer gave the sight picture. But I do want to say thank you again, as you heard Commissioner Franz comment on foresight by those who came before me and in the last legislative session when we worked together to get a good budget that was balanced and grew the economy in a way that made sense and also put away those rainy day funds. So to Governor Dayton, to those legislators who made sure that Minnesota had one of the most, if not the most robust budget reserves, and it's one of the reasons why Minnesota's fiscal health was one of the strongest going into this, and it positions us better to come out of that. But there are, as you heard, there's decisions to be made. There's going to be shared sacrifices sacrifice, because at this point in time, the COVID-19, as some have said, is not the great equalizer. It exposes inequities. It exposes communities that get hit harder, especially communities of color. And as you heard Budget Director Rayton clearly state, the countercyclical nature of this is it forces people into government programs. And those programs are meant to be there for that rainy day. They're meant to be there as a safety net. So there's some things that we are going to have to do together with the legislature. I do also want to say Commissioner Franz is right. This is going to be an ongoing process. This is not a one and done and leave. And this is not looking at just the moment. It's looking at that long-term horizon. And there's also, as you heard in the presentation, there are uncertainties in this. There are uncertainties of how long this lasts. There are uncertainties on how society responds to a reopening and social distancing. There are uncertainties in how close we and how soon we get to therapeutics and potential vaccines. But Minnesotans have approached budgeting with a very conservative approach, a very forward-leaning approach in terms to the things that grow the economy, and now is not the time for us to back off on those. It's time for us to make hard decisions, but to be thoughtful on how we do that. So over the coming weeks, this data will help drive some of the decisions we need to make. It'll let us look hard at how do we make this budget balanced, because again, states cannot run deficits. That is a wonderful thing, and it's the way to do it. But in a time of deep crisis, deficit spending at the federal level is absolutely necessary. And I think one of the things that we are still advocating for, and I was on with our federal delegation this morning, is direct support to the state and local governments who are doing the very things like contact tracing, like putting out fires, like trying to figure out how we're going to educate our children and not lose this time in building that workforce for the future. So these are decisions we're going to have to make. We need to look out for one another, and we need to get ready to make some of those hard decisions, but with thoughtfulness in them. It also brings us today, as some of you are seeing this, trying to manage the complexity of the coronavirus as we close the economy down, as we started to use social distancing. Everyone understood there was going to be a catastrophic effect to the economy. Now we're getting a better picture of what that looks like. And after about a month and a half, we're getting better data on how do we best control this. And you heard us talk yesterday about trying to understand how do you restart some of the retail businesses. One of the areas that we have been focused on for a long time is trying to figure out how to make sure that the hospital care in our personal protective equipment, ICU, and care providers is ready when, and I think we all need to acknowledge this, Minnesota numbers are still going to increase. Minnesota's numbers, we are not at our peak yet, and there are some dark days ahead of us, but we've changed the calculus. We've changed the calculus just like we did on budgeting by having budget reserves. We've changed the calculus on how we approach this with PPE and readiness. And it's one of the reasons today that I'm signing Executive Order 2051, and you'll hear more from our team at Health, that allows folks to go back in, doctors, dentists, veterinarians, with elective surgeries and procedures. That's after completing a plan, complying with the requirements set by the Minnesota Department of Health. To give you a simplified picture of this, these facilities are going to know what the projections look like for the surge. They are going to have to say, we have those supplies in reserve for when that happens, but because of the work we've done both inside government and outside, we have excess above that right now. And we are going to make a calculated risk and a calculated choice to start bringing back in those elective surgery with a clear understanding. You've heard me say that my responsibility is the safety, the health, and the well-being or the happiness of Minnesotans. Their healthcare providers are going to triage these and bring folks back in. This is a quality of life issue. And Jan Malcolm will talk again about not putting off things that need to be treated, because we're going to come out of this thing with worse problems health-wise that could have been prevented. And we believe that this move now, with feedback and over 1,000 comments specifically from a lot of healthcare providers and folks involved in this, we believe that they're prepared to do it. And this action is consistent with guidance from the Centers for Disease Control and Prevention and the Centers for Medicare and Medicaid Services, CMS, as a temporary measure to ensure that PPE and ventilators were preserved for use for COVID-19 patients and they'll be able to provide care. Fortunately, we've been able to do that, but I do want to note, our nurses and our frontline healthcare personnel are nervous about this decision. I want to recognize that and know that we have been in direct consultation with them. They are concerned that we do not move towards this, depleting theirs, or putting them in the front line now in some positions where they don't feel like they have the proper protective care. So this is once again where I would ask all of you, if the folks listening today want to know what you can do to help prevent that is, continue to social distance, wear a mask, don't go out if you're sick, only go out for essential services. Every time we do that, that's one less potential person, or the way this is spreading, 2.3 less potential people to go into the healthcare system to burn the PPE or to put those nurses in a position where we have to make that choice. So we think that with the decisions that have been made, the social distancing Minnesotans have done, our good handle on what the inventory is, that we're able to do this. So you're going to hear a little bit more about this in the details on how it works. But this is a move, I believe, that strikes the proper balance between holding COVID flat, moving things out, but also recognizing that quality of life is impacted by that. Same discussion we're having about the economy. And finally this week, before I turn it over to Commissioner Malcolm, this week is Teacher Appreciation Week. If there were ever a year to have Teacher Appreciation Week, this would be the week. They have always been selfless public servants. They're there for our children. They build the relationships that save lives. Every single one of you listening today know that teacher who spent the little extra time with you or gave you the inspiration that led you in a direction that impacted your life. Now we're asking them to do that in a very difficult way. I also know there's an awful lot of stress on those teachers. They're feeling the loss of these children in their classroom the way the children are feeling the loss of that connection. And so it has been an exceptional school year. I'm incredibly proud of our educators and our students and our parents for making the best of this as we continue to move forward. And I would just say, as someone who spent several decades in the classroom, for those of you out there, we do, when those notes come to us, we know it and we keep those. I kept several of those in my desk over the years that out of the blue, when a parent or a student would send just a little note, it made a difference. So if you get a chance this week, maybe drop a note, drop an email or something to that teacher that's making a difference. I know that'll help. So with that, to update us on the current situation, Commissioner Malcolm.
Thank you, Governor. Good afternoon. Well, here first is the situation update for today, globally and nationally. As of early this morning, around the globe, there were more than 3.6 million cases of COVID-19 and 251,000 deaths. Here in the United States, we were at 1.2 million cases and 69,000 deaths. In Minnesota, as we have been saying for the last few days, as our testing increases, as the disease progresses in our state, we will see more numbers like this. Today's total is at 7,851 cases, up more than 600 from yesterday. We had an additional 27 deaths yesterday, so we are now at 455 Minnesotans having lost their lives from this disease. Again, 23 of these 27 deaths occurred among our elderly and among residents of long-term care facilities. This set of deaths includes 19 in Hennepin County, 3 in Anoka, 3 in Ramsey, 1 each in Clay and Sherburne. Demographically, the pattern continues to be 4 people in their 90s, 11 in their 80s, 6 in their 70s, 5 in their 60s, 1 in their 40s. So we are, again, seeing some younger persons, some with underlying health conditions, some inexplicably not. Just goes to show that this disease is very unpredictable, and no one is immune from it. There are 434 patients currently in the hospital, 182 of those in intensive care. So we continue to see these numbers increasing gradually as well. In terms of some key messages for today, I just want to say one thing about the some of you who have really eagle eyes are looking closely at these numbers and notice that we saw a drop in the testing volume yesterday. I just want to explain that there was a technical glitch with the data interface between the labs and the labs that report into MDH. That's been resolved now, so tomorrow we expect to see a bump up. We're estimating that there were probably, in reality, about 3,800 tests processed yesterday, as opposed to the lower number that was reported. But we will see back to accurate numbers tomorrow, we believe. Again, as I reported yesterday, the 5 counties with food processing plant outbreaks are still accounting for a majority of the new cases that we are reporting. Fully a quarter of the cumulative cases are coming from those 5 counties at this point: Nobles, Candy, Ojai, Stearns, Martin, and Cottonwood. And with that, I want to turn just briefly to the executive order that Governor Walz just announced. The new Executive Order 2051 is intended to clarify and liberalize the requirements for providers to be able to provide elective surgeries and procedures that utilize personal protective equipment or ventilators. The original order was all about that. It was about the preservation of ventilators and personal protective equipment. The guidance was always for providers to restrict procedures that used those particular important resources. But because we know that we are in an evolving epidemic, that it's taking a while for us to reach peak thanks to some of the community mitigation measures that were put in place, and we have been saying for quite a while that we are concerned with the amount of procedures that we know are being foregone, care that should be being sought that isn't being sought, both out of perhaps a fear on the part of patients that the healthcare system might not be safe, and because providers were taking this guidance very literally and very cautiously in terms of preserving the PPE. As we have built up those supplies, we believe that it's time to give providers more freedom, more flexibility, but also more responsibility to strike this balance in a different way. So the executive order lifts the restriction on elective procedures under the condition, as you've heard with some of the other business openings that we've announced, that healthcare providers have a plan for how they are going to monitor their PPE supplies, how they're going to keep an eye on conserving enough of that supply to be able to respond to a surge in cases when those start to come. So they need to have plans for how they're going to screen patients, how they're going to protect staff, how they're going to keep track of PPE, and how they're going to collaborate with each other when it comes to looking at what the region might need or how they might need to share across their different provider organizations. So this is really intended to give providers the ability to make those decisions with some requirements of certain things that they need to think about and how they need to describe how they're going to manage this balance and how they're going to assure staff safety and patient safety in this environment. They don't have to file these plans with us for approval, but they need to have them. I want to publicly thank Assistant Commissioner Marie Dotseth, who's here and can help answer questions if you have them on this order. But Marie and a great team of interagency folks, including some colleagues from Management and Budget, helped to process these an extraordinary amount of detailed and technical comments in a very short amount of time and did it very thoughtfully. So I appreciate the opportunity to say thank you to Marie and team. With that, Governor, I'll turn it back to you for questions.
Thank you, Commissioner. Well, once again, you can see we're approaching this in a Minnesota way. We're being thoughtful about it with an understanding of trying to strike that proper balance. And I can tell you that the conversations that happen there are, as you heard, thousands of comments and a team that's out reaching out, talking to the folks involved. This morning, I spoke extensively to the federal delegation. This afternoon, we'll be talking to our faith leaders and our tribal leaders. The complexity of COVID hits all parts of our life. It hit the budget, it obviously on the healthcare side, education side, mental health sides of things. And then we'll be talking this week about what would normally be a very festive weekend for us, one that I think when you have the privilege of being governor, one of the best things you get to do is go to the fishing opener. That won't happen this year, but we'll talk about how people can enjoy the outdoors and do that in a responsible manner. Again, I just keep coming back to it. The biggest thing all of us can do is continue with these social distancing, and we're trying to figure out how do we maintain this in a way that is sustainable and yet allows enough things to go back into the economy to start to bring that dip that you saw on the chart back out. And I can tell you, I talk daily with many governors. We're all trying to figure this out, and we all end up talking about it that not surprisingly, shared commonality around issues that we want to tackle: long-term care, congregate living. Those spring up in Maryland, they spring up in California, they spring up in North Dakota, the same way they do here. And I think that sharing of ideas hopefully gets us where we're going to go. At this time, I think we wanted to leave a bulk of the time. Got a lot of experts here. I would ask our experts to maybe make their way up or here, because I think our journalists will probably want to dig deeper into these numbers. So go right ahead with any questions you have.
Governor, Matt Seppi from NPR News. Given the projected deficit, are you planning for any layoffs or furloughs of state employees?
Yeah, and I think Myron can come up and talk about this, that my guidance to them was put every scenario on the table. We thought one of the first things we did is I asked my commissioners and myself when this first started to do a pay cut. The one thing I would tell you is when we dig in this, if you look at just state workers as a portion of the state budget, it's about 7%, I believe. The bulk of this goes to healthcare and goes to education. So if you laid off every single worker we had, which meant there's nobody at the health department, there's nobody at MMB, there's nobody in the schools, there's nobody plowing the roads, you'd save about 7% of the budget. But I do think there's a responsibility, just like everyone, to figure out what's the smart way to do that. And I think many are bracing, and this would be where the economists could weigh in. The next wave in terms of the unemployment may be state, local, and county officials. That's one of the things that we're looking at. So my pledge to Minnesotans is, just like we built a very resilient, smart budget together with the legislature and working with Minnesotans, that's the way we're going to approach this. But certainly at this point in time, we have to leave everything on the table.
Governor Lou Raguse from KARE 11 News. Do you have concern that the deficit could continue to grow much larger in the coming months? And if so, does that, with considering unemployment, potentially put the unemployment insurance fund at risk of running out?
Yeah, this is a really good question, Lou, and I probably should have Steve Grove here, but one of the things is very early in this, right before we started even making the payments, when we knew that there was going to happen, I asked about the stability, and they ran some scenarios, and I want to make sure that they get you those exact numbers. But the way I understood it, at a projection of about where we're at right now on these numbers, that Minnesota was good out until October. The reason this came up is my colleague J.B. Pritzker in Illinois talked about their system was only good for about 30 days in terms of the volume that they had. So I do believe that's that we're solid, we're thinking about it. And your first question is, yes, before COVID-19 even started, I was making the case that we had saw the largest expansion growth period in American history, and that it was just simply cyclical, that there would be a downturn. I never would have been able to forecast the black swan of COVID-19, but it is here. I think it would be smart for us to take a very conservative approach to assume, again, if you saw yesterday, the White House numbers came back again. I think the hard thing to wrap our minds around is watch a lot of news out of New York and watch some of the early nations in Europe and Asia go through this, that there is a false belief that we are past the worst of this. We are not. As a nation, our peak is still coming, and I think that's going to be the thing that we have to grapple with. So I'm going to anticipate that this could deepen in terms of the deficit, and we should approach it that way. And take this a step at a time. And I think that was Commissioner Fran's guidance to us, to be careful about the reserves, to think about the ways that there are many tools to use. It's not just dump the budget reserves in and you're even today, because tomorrow, if we go back in, it's not there.
Just a quick follow-up on that. Are there other cuts that are on the table? You mentioned the furloughs and the layoffs.
Well, Myron, you can talk. I asked them to put me together as massive amount of scenarios as they possibly could. Some of them are pretty unpalatable, but I do think you at least have to look at them. So maybe I'll have Commissioner Fran.
Yeah, thank you, Governor. As you know, the budget process, it's really a math problem, right? You have spending and you have revenues. As our revenues have dropped, now we need to either use the budget reserve and or do some spending cuts or find other spending opportunities. Obviously, some of the federal money will help us support some of the state spending, so that will be part of the issue we can deal with. But we were looking at cuts and different scenarios all across. This state's been through a lot of different ups and downs with budgets, so we have a lot of experience dealing with different funds and different ways of managing the cost. But as the governor said, the biggest costs that go out every year are for health and human services and education, and there's not a lot of money in these other places to find. But we're going to look everywhere, as the governor said. That's our goal.
And I think too, Lou, if answer up, and this is the legislator's job too, and we'll work together with them. They'll want to be, they need to be a part of this, and we'll start looking. But I think at this time it's really important that every potential scenario is on the table. But again, I want to be very careful. It's in times like this that you can make an austerity mistake and cut the very things that will grow that economy, and then you end up staying at the bottom of that trough for a longer period of time.
Governor Walz, Scott Peterson, Minnesota News Network. The Coalition of Greater Minnesota Cities came out with a reaction to the budget projection earlier today, saying city officials are anxious about their LGA payments. Are they going to get LGA, and what would you say to allay those fears?
Yeah, and I would say with everything on the table, I think that you do get an idea of where people's ideology is around budgeting and good fiscal management. I made it a very central piece to restore LGA back to where it was in 2002, 2003. I think it's smart usage of this. I want to speak to all of those mayors, city councils, school board members, county commissioners. We're in this together, and we're trying to figure out what happens with the federal money that comes to us. That really is the game changer too. And keeping in mind, Minnesota is a state that is nearly the last one that gets money from the federal government. We're 47th. We give, and our money goes elsewhere, which we are proud to help the country, whether it's for defense or other things like that. At a time like this, our hope is, and we'll keep asking, and on a call yesterday, Secretary Mnuchin seemed to indicate that there was more flexibility for us to be able to use this money. The one thing that I will tell you is that I am deeply concerned about local budgets. I view it as our responsibility to figure out how to be partners with them to get that out. And again, that's a conversation I had with the federal delegation this morning, and that is a real point of emphasis for the legislature to figure out how do we help these budgets.
Governor, this is a question from Jeremy Olson at the Star Tribune. The COVID-19 dashboard online lists the delivery of 1.5 million N95 masks as unclear, and the delivery of many face masks and gowns as weeks past due. Are you concerned that this supply won't be there, particularly given that we're resuming elective surgeries at hospitals?
Yes, and this was one of the calculus that we put in, and I think I'd be disingenuous. I right now, in the situation we're in, you saw it happen today. Governor Burgum in North Dakota, I think, is doing a really fine job and being very aggressive trying on their testing regimen. They had some big testing things set up. Those were canceled because they don't have the supplies. They didn't show up after they set it up. So I do think this issue, and again, this is not a political football. It is not a point of contention nor blame, but the reality is supply chains are still incredibly tight. Supplies for testing and PPE are still very competitive amongst states and nations, and I think until they're in your warehouse, there's a little bit of concern. The one thing is, though, is this team has proven to have reliable suppliers. They have strengthened the supply chains, and I believe, Joe, I'm not speaking out of time here, you build redundancies in to make sure if one falls through, another comes through, and they're not all of our eggs in one basket. But it is a very valid question, and I think it's one of the reasons we're asking these individual healthcare providers to monitor this very closely, and I think it is not only possible, it's probable. Some folks out there might say, oh, this is great. They may call in and they may find that their local provider is not going to do it because they're nervous about this. So this job continues on, but the answer is yes. I worry until they're in our hands.
Governor, with the spike in the ICU and hospitalizations recently, are you still confident in being able to open up these elective surgeries, and what would you tell a medical worker who sees the numbers and would be concerned by that?
Yeah, this is a really good question, and it seems counterintuitive, and I think it's this whole COVID fight. You feel like you're walking on razor blades constantly because of the balance of what it takes. It's that desire to open the economy, it's the desire to get things back to normal, but to understand what it takes to be safe, because it shouldn't be missed on anyone. On the day we announced the most deaths and the highest increase is the day we are talking about elective surgeries. The other piece of that is Joe and Commissioner Roberts Davis, is the PPE is in a better space than we have. But yes, I want to say I'm concerned, and I will reiterate that. Mary Turner from the Nurses Association, who calls me from when she steps into the hall from treating people on the front line, and tells me where she's concerned, that registers. And on the way over here, she was in the basement of the hospital, couldn't catch my call, texted back, and did express that there is a nervousness around this, and there's a responsibility for us, both as state and the hospital providers, to not put those frontline workers in harm's way. But I will appeal to Minnesotans again. Every time you gather close together without a mask, there's a chance you're putting that nurse at risk. There's a chance that we're burning more PPE. And that's where I would appeal for some of that. But yes, the question is fair. It's one that we weighed very heavily. Jan, do you want to, I know we've grappled with this for weeks.
Yeah, thank you, Governor. I just wanted to reiterate the point that I think both of us have made several times, and that is that we are very mindful and becoming increasingly concerned about all the other services that are being put on hold, we think dangerously and unnecessarily. That yes, it's a matter of keeping a balance. That's why we're saying that in these plans, providers have to know what their PPE supply is, what their projection is. We've got this great regional collaborative approach. We've got good line of sight, much better line of sight than we had at the beginning of this epidemic, to where what the usage rates are. We've calculated out how long of a supply do we have in hand today at multiples of the current utilization rates. So we are confident that today there is capacity in the system for people to be getting life-saving care that they need, care that was never prohibited by the original order. But I think that there was just concern on the part of patients and providers that they needed to pull back more than is good for the health of the public in so many other ways. So this is really about striking a balance to say, of course, people who need a surgery or a procedure to treat something that otherwise is going to progress and become life-threatening or function-limiting in its own right has to be our priority as well. So we fully appreciate that this is a balance to be struck, but especially, frankly, with our success in moving the peak out, we were just unwilling to say COVID is the only thing that we can keep our eye on. And we recognize it's a balance, but we trust our providers. They know their communities, they know their patients. They are going to have to be setting some prioritization criteria for what they think they've got capacity to do and not. So I appreciate the governor pointing out that this doesn't mean every provider is going to be wide open for everything tomorrow, but that they will be working hard to protect their staff, protect their patients, and get more of the needed care going as soon as we can.
Commissioner, can I just follow that up based on what Lou said about ICU cases going up? I'm seeing that 16 new ones today, 20 new ICU patients. I believe it was Sunday. Do you know what's behind that sudden increase, if you can even call it a spike at this point?
I actually, as we're seeing the numbers, they're very moderate for where we are in the progression of the pandemic, and they're well within the ranges that we've projected. So, I know this is a little concerning to say, but this is not the steepest part of the curve. We're still seeing, particularly when it comes to hospitalizations. Yes, we're seeing a lot of cases. We're testing more. We're finding more. The great majority of those cases are not needing hospital-level care. So the number hospitalized and the number in ICU are really very well within the ranges that we have projected.
Jan, can you mention about doubling in those numbers about kind of as a measure? This is an interesting part of, because once that the doubling speed starts increasing.
Yeah, we've talked about that a couple of other times. It's a metric that we track. How many days does it take for cases, for the raw case count to double and for the people in hospital to double? And it goes up and down a little bit, but we're still at a case rate. I believe today's doubling time was 8 days or something like that, which is still pretty healthy. When the red alarms start coming is when cases double every 2 or 3 days. And the same is true for hospitalizations. And the ICU rate of increase has actually been, if you look at the curves, the ICU rate's quite a bit less steep than the non-ICU bed utilization. So we're still feeling pretty good about that.
The question is a really good one, and I think it prepares us, and this is, again, talking honestly to Minnesotans. This is going to look terrible. It was hard for me on that State of the State to acknowledge that Minnesotans were going to die, and that was starting to ramp up. And if you think about that, that was 29 at about that time, and now we're at 455 and climbing. The rates, even when we do everything right, are continuing and are going to continue to go up. So we do need to watch that closely, and all of it plays together. But it is a very valid question.
Governor Walz, this is a question from Kevin Featherly of Minnesota Lawyer. You said earlier with regards to the budget, it's not a one and done and leave. Does that in any way suggest that there would be a need for a budget cutting special session?
Well, Myron, you've been through this. I think everything's possible now. What I don't think is going to be healthy here is I think one of the things that we can do to give there's a few things that we can put into place that will allow us to be smart about the budget, to not overspend, to get a good eyesight on revenues, and have that conversation. Most important thing is to get the local jobs and project bill, the bonding bill done. We're able to do that. That's able to help. But what I'm a little bit fearful of is there's just the nature of these things. The people, especially in this room and those who watch politics closely, we have a 4-month session that really boils down to 72 hours in the last 3 days, every single year. Good years, surplus years, deficit years. It's human nature that we don't cut the deal to the end. That we cannot do this time. We cannot view that we're going to fix this budget situation in the next 15 days. It's not going to happen, and I think that's what Commissioner Franz, Budget Director Rayton are cautioning us against. So I think it is more than likely that the legislature that needs to be intimately involved in all these decisions is going to have to be prepared that that's what may happen. I do think there are some things that we can do that would allow us to function very healthily along the route that we're going, that we can get done in 15 days, but I think there'll be a need to probably do more.
Governor, do you plan to extend your peacetime authority, that first executive order, the peacetime emergency?
Yeah, we don't, and again, I don't create uncertainty for the sake of uncertainty. I think being very candid that we assess, and I know people want as much lead time as they can get. I believe that extends till the 13th, if I'm not mistaken. That's the peacetime emergency, the stay-at-home order till the 18th. What that authority gives us is the ability to do certain things that I wouldn't have the capacity to do, whether that's using the National Guard or the ability to move some folks in health. So we'll reassess it. I think, again, just to preview that, I think it is more than likely that we will at this time, but we will certainly, as we get closer, as we're doing now, start adding in all of the things that the data points to tell us if that's necessary.
Governor and Commissioner Malcolm, just combining a couple questions here on hospital capacity. Those processing plants tend to be in rural areas like Nobles County, Martin County. How prepared are the hospitals in those regions to handle a rush of patients?
Yeah, I'll have Jan come up, and I just did make this note, and I'll keep making it, that this is how quickly this can happen in rural areas. Stearns County is a concern now. Nobles County and Stearns County have far surpassed Ramsey County. Nobles County with 21,000 people has over 1,100 cases. Ramsey County with 550,000 people has 580 cases. So that is a deep concern. It's one of the reasons why when people say, well, the rural areas aren't as susceptible, let them go, that's exactly the point. So I'll let Jan talk about it.
We do we keep an eye on not only capacity in aggregate, but regionally. There's a dashboard that kind of shows how each region of the state is doing on capacity. So we definitely have our eye on the Southwest and on Stearns. And yeah, either Joe or Marie, if you have anything more specific you'd like to say, I welcome you to come on up. But at the present time, I think the capacity in those areas is holding quite well. What we certainly don't know yet is how much more might this grow. We are working really hard to help the plants and the communities find those cases quickly and isolate them and quarantine anyone who's been exposed. But that is, we're definitely learning, as the governor said, how quickly things can spread. Another thing I just would like to remind folks of is that we've got a system in place that if capacity does get constrained in a region, there's a backup system in place to help find the right level of care, intensive care if needed, for those patients if the region is tapped out. So there's a great 24/7 system for getting the patients to where they need to go.
And to follow up then, regarding the 72-hour plan for doubling the ICU capacity, how close are we to that threshold? Could you kind of put in context where we're at and where we would have to be?
I'm going to just invite Assistant Commissioner Dotseth up to speak to that. She works daily with the State Healthcare Coordinating Center that keeps eyes on that.
That's a good question. Let them know how it's going to kick in.
Yeah, so as Commissioner Malcolm was saying, we track that capacity number daily, and right now we're using the conventional ICU capacity. So until that capacity becomes exceeded, those 24 and 72-hour capacities for ICU don't need to be used. But we're working with the hospitals right now on making sure that they really are making those plans to use those spaces for critical care in all the different regions of the state. So we're not to that point yet, but we're confident that when they get to there, we'll be able to expand into those critical care spaces.
And those gates that get tripped, there's like a distant early warning of tell us where it's there. And that's what Joe did the validation of the alternate care to see that. Should that be needed in the other validated alternate care sites, they know now they can do it and what it takes to do it. But each individual hospital is going to tell us what they need to do.
This is from Mary Lahammer at TPT. She says, Minnesota insurers have said they'll cover COVID testing, yet they're not necessarily covering COVID immunity testing. Should that be covered, and what can the state do now that those tests are underway?
Yeah, Jan, that's a good point. And I would just make mention of this if you saw this, and I think this was a good move. And I understand the sense of urgency, but we had a long conversation with this, that FDA's move to basically let everybody go on the serology test, put a whole bunch of junk on the market. They pulled that back in the last 2 days. Our thinking is that should some of the validation of the results in South Korea, that there does appear, at least early, not validated, the tests need to be peer reviewed and everything that goes with it. But if there is immunity and it makes sense to have good serology testing like our healthcare systems here have, that will be a huge key. And I think at that point in time, Jen, I don't know if they're not paying for it now, but boy, I can tell you that my first blush would be that would be the smartest thing we could do, and we'd certainly ask them to do that.
That would be a good conversation to have.
Good conversation to have.
One more question, Jeff.
This is a question from the Pioneer Press. We're hearing that Denny's Barbershop, the one that opened yesterday here in St. Paul, has been shut down by police. Others around the state are opening for walk-ins if they haven't already, and they're hearing reports of a smattering of businesses, even a rural gym, small city boutiques opening in violation of your orders. What do you have to say to these businesses?
Yeah.
What do you have to say to these communities? I mean, there's Lakefield apparently has approved a resolution declaring them to be constitutional and business friendly. What's your message to them?
Well, first, I want to be empathetic to the frustrations people feel. I want things open as badly as they do. And that desire is pretty much human nature. The thing is those constitutional authorities that are vested in us, we use them judiciously in the protection of public health, and it's public health advisors letting us know what they can do. I've said all along that this is going to take social compliance based on the science and what we know can help our neighbors. We're working very closely with major salons, the Cosmetology Board, trying to come up with those plans to let people go. Now, are there people out there in these businesses that have created plans that will meet or exceed what we eventually end up with? Yeah, that's possible, but in every society, you've got to have an orderly way to do this. And if there's just the decision that we're going to go and do whatever we want to do, that puts it all at risk. And the thing I would tell you this risk becomes real when you're young, you're healthy, you're fine. Somebody's mother, somebody's father, somebody's grandparent is put in a position where we overflow the emergency rooms, and at this point we haven't. So, this is one of those difficult things that if we do this right, it'll appear like we're wrong because we didn't overrun the healthcare system. And it's a bit like someone who can't swim and you keep them out of the water. Whether you can claim you kept them from drowning or not might be a little bit debatable, but I'll guarantee you, had they jumped in the deep end, it would have been trouble. And I just want to continue to encourage people. I hear you on this. We're trying to get you back as smartly as possible. The disregard for it, and again, we're a united country. We have a federal system. If each community is going to determine on their own it makes it very difficult to have community health, because if that community ends up spreading to others, it is a problem. So I would encourage them. It is not our intention nor our desire to use police time and resources to do this. I would ask people to do the right decision, to do the right thing for their neighbors, to work with us on getting these open in a reasonable manner, and again, to recognize we're going to have to do this together, and we're going to have to do the social distancing until there is herd immunity or until we have therapeutics and a vaccine. We are just slowing that down in a way that I think, I would hate to say it, it's certainly not unanimous. The preponderance of epidemiologists and medical professionals agree that it's right. And I would add, economists believe that the only way this is really going to work if there's trust in going back. And I have to tell you right now, I would be a little bit nervous if somebody is not listening to the health department and not listening to others and deciding it do on its own. Yelp has a way of making those types of things come back. If you say, why are you doing this? Follow the right way, do it the right way, and we want to get them back into work. So with that, I'm going to close with one great story that I saw, and I know this is happening elsewhere, but I saw it in Carver County. Hamburg Lions Club, this is my shout out to them today. They're turning everybody's neighbor's little library into a little food bank. And they're putting cleaning supplies and non-perishables in there, and folks are exchanging that way. And that is just, again, that's how neighbors act. That's how they do. That's how they do things. And to the Lions Club out there in Hamburg, thank you for making somebody's day a little brighter. And it builds a sense of community. You know your neighbors are looking out for you, and it's about all of us in this together. So thank you all, and we'll be back again tomorrow. Thanks, Commissioner. Thanks, team.